Hey new nurses, welcome back to New Nurse Bootcamp. Now in nursing school, they taught you tasks, but not how to think like a nurse. You are not dumb, you are just new, and this is why it feels hard. Now this is where clarity starts, now let's lock in. So let's talk about early status changes, or status changes in general. A status change is not a mystery, and it's not something that just happens all of a sudden. Generally, a status change means something in the body is no longer staying balanced. It usually starts quietly before it has to yell. Now, a status change can look like vital signs becoming abnormal, whether they're trending up or down, they're outside a normal range. It can look like a patient needing more oxygen than before. It can look like a heart rate or blood pressure that's drifting from their normal baseline pattern. It could be new confusion or slower responses, or even more agitation in a patient. It could be urine output decreasing, where they may have went from 50 mLs an hour to 10. That's a drastic change. It could be pain or symptoms that are not improving as expected or getting worse. Now, these changes don't happen in isolation. They signal that one or more body systems are under stress. Now, for example, sepsis, another big buzzword in the hospital or in healthcare, and it's often a major complication. Now, sepsis is considered to be 2 or more abnormal vital signs and a confirmed source of infection. But sepsis cannot be determined if the small status changes are not recognized and escalated effectively, appropriately, and timely. So a status change is not about panic. It's about recognizing the early signs and responding before the patient becomes unstable. Safe nursing means noticing change early, not waiting for a crisis to prove you that you were right. New nurses, welcome to the New Nurse Bootcamp. You are not dumb, you're just new. This is where clarity starts. Now lock in. Let's talk about long-term acute care hospitals, or LTACs. They're not often talked enough about in nursing, so let's define them clearly. Now, LTAC patients are seen as stable, but not just because they're chronic. They actually require advanced nursing skills and continuous clinical judgment. Now, LTACs nowadays are almost equivalent to a hospital step-down unit minus the titratable infusions. Now, in the U.S., most facilities, their staff nurses, they're going to have 5 to 6 patients per shift on these units. And this ratio is reflected based on the reality that these patients are complex and not low acuity. Now, LTAC nurses can manage patients with prolonged respiratory failure and ventilator dependence, whether it's from a trach, or generally it's going to be on a trach and not an ET tube. They're going to have complex wounds, infections, and long-term IV therapy. They're going to have multiple body systems that are requiring ongoing support. Now, these patients may not change from hour to hour, but the margin for error is still small. Now, safe LTAC nursing depends on recognizing subtle trends over time, understanding which body systems are most fragile or unstable, and managing multiple therapies simultaneously. You also have to escalate early when the patient's progress is stalling or declining. LTAC nursing is not rapid rescue. It requires sustained monitoring, prioritization, and precision across higher ratios and longer timelines. This is advanced nursing care. Hey new nurses, welcome back to New Nurse Bootcamp. So in nursing school, they taught you the task, but not to think like a nurse. So you're not dumb, you're just new, and this is why it's hard. Now this is where clarity starts, now lock in. So let's talk about ventilation. Ventilation means how well the body is moving air in and out, right? It's the gas exchange to remove oxygen and to remove carbon dioxide and to pick up oxygen. And it's different from oxygenation. So a ventilation problem starts when the body cannot get rid of carbon dioxide effectively. So some early signs of this is like slower and more shallow breathing. It's increased work of breathing, headache or flushed skin, drowsiness or new confusion, or even if you do an ABG and you see a rise in CO2. Now, oxygen levels can look okay even while CO2 levels are rising, so this is how it can get missed. Ventilation problems affect the brain first, so look for neural changes first, right? Changes in alertness are often the earliest cue. When breathing becomes less effective, even quietly, that is a status change. Recognizing a ventilation issue early allows nurses to intervene before breathing becomes unsafe. Hey, new nurses, welcome back to New Nurse Boot Camp. Now, in nursing school, they taught you tasks, but not how to think like a nurse. So you're not dumb, you're just new, and this is why it's hard. This is where clarity starts. Now lock in. Let's talk about perfusion, when the blood doesn't reach the organs. So perfusion means how well blood is moving through the body to deliver oxygen and nutrients to your organs. A perfusion problem doesn't always just start with low blood pressure. It actually starts when the organs are not getting enough blood flow, and one result is low blood pressure. So early signs of perfusion trouble would include increased heart rate, decreased urine output, cool or pale skin, delayed capillary refill, and a rising lactic acid if labs are available. Now, blood pressure can look acceptable while perfusion is declining. That's why you need to look at other things such as urine output and trending your vital signs. Perfusion problems affect the kidneys, the heart, and the brain first. When circulation is no longer meeting the body needs, this is a status change. Recognizing perfusion issues early allows nurses to intervene before organ function is compromised. Hey, new nurses, and welcome to the New Nurse Bootcamp. In nursing school, they taught you tasks, but not how to think like a nurse. Now, you're not dumb, you're just new. This is why it's so hard. This is where clarity starts. Now lock in. So let's talk about oxygenation. Oxygenation means how well the oxygen moves from the lungs into the blood so the body can use it. Remember, your organs need oxygenation or oxygen and perfusion, the blood circulation, right, to be useful. An oxygenation problem does not start with a crisis. It starts small and quiet when the body needs more support than it did before. Now, early signs of oxygenation trouble includes increasing oxygen requirements. If they go from room air to needing like even a nasal cannula, something is going on. Faster breathing, restlessness or anxiety or even agitation. New shortness of breath, and oxygen levels only stay normal with added oxygen support. Now, a patient can still be talking and still be alert and already struggling. Oxygenation problems are not just about comfort. They're about whether the organs are getting what they need to function. When oxygen needs keep increasing, that is a status change. Recognizing oxygenation issues early allows nurses to intervene before breathing becomes totally unstable or the patient goes into respiratory failure. Nurses, and welcome to the New Nurse Boot Camp. Now, in nursing school, they taught you tasks, but not how to think like a nurse. You're not dumb, you're not new. This is why it's hard. This is where clarity starts. Now lock in. Now let's talk about the neural status. Neurological status means how well the brain is functioning, thinking, responding, and staying aware. A neural problem does not always start with dramatic symptoms. It often starts with small changes in behavior and responsiveness. Now, early signs can include new confusion or disorientation, slower responses to questions or stimulation, increased sleepiness, lethargy, or difficulty staying awake, agitation, right, where it's like non-purposeful moving, or restlessness that is new, headache or complaints that don't fit the situation. It could even be vision changes. Neurological changes often are secondary, meaning the brain is reacting to another problem that's underlying, like low oxygen, poor blood flow, infection, or metabolic imbalance. So that's why mental status assessment is actually a vital sign. When a patient's thinking or responsiveness changes from their baseline, that's a status change. So recognizing a neural changes early on allows nurses to identify underlying problems before they become severe. Hey, new nurses, welcome back to New Nurse Boot Camp. So in nursing school, they taught you tasks, but not necessarily how to think like a nurse. You're not dumb, you're just new. This is why it feels so hard. So this is where the clarity starts. Now it's time to lock in. Let's talk about metabolic status. Metabolic status refers to how well the body is maintaining balance at a cellular level, including blood sugar, electrolytes, acid-base balance, and energy use. Now, metabolic problems are often quiet at first. They don't always cause pain or obvious distress. Some early signs of metabolic change can be abnormal blood sugar levels, electrolyte imbalances, unexplained fatigue or weakness, nausea or poor appetite, changes in breathing patterns, lab values slowly drifting outside normal ranges. Now, metabolic changes often happen because of another system is under stress, such as infection, poor perfusion, kidney dysfunction, or respiratory failure. This is why labs matter and also not looking at things individually. The trends are more important than just single results. When the body can no longer maintain internal balance, this is considered a status change. Recognizing metabolic issues early allowed nurses to intervene before multiple systems are affected and the patient trends become over obvious and unstable. Hey, new nurses, welcome back to a new nurse boot camp. In nursing school, they taught you all the tasks, all the theory, but they didn't teach you how to think like a nurse. So you're not dumb, you're just new. This is why it feels hard. This is where clarity starts. Now lock in. Alright, so we're going to talk about post-op status the right way. Post-op patients are expected to be uncomfortable, but they are not expected to get worse. A status change happens when recovery is not matching the surgery. So this is what you need to know every single time. Now, number one, what procedure did they have? Where is the site? Do they have any drains? And what is it supposed to look like? And what is it dressed with? Or is it open to air? Because day one post-op does not look like day 3. Number 2, what is expected for this surgery? Some pain is to be expected, some swelling is to be expected, but the body should be moving in the right direction. Now, number 3, what is abnormal for this patient and this procedure? Know their baseline and what is expected with this procedure. If the pain keeps climbing, the heart rate won't settle, and oxygen needs keep going up, urine output is dropping, confusion that is now present that wasn't there before, those are all bad signs. Now, post-op patients are vulnerable because multiple systems are adjusting at the same time, whether that's breathing, circulation, fluids, or pain control. So if things aren't lining up, don't minimize it, escalate it, and see what's going on. Now, that's not just post-op, that's a status change. And catching it early, that's good nursing. Hey, if you're a new nurse and you feel pressure to already have it together, but you're worried you might miss something critical, pause and take a moment. This is for you. Now let's talk about sepsis. Sepsis is commonly overlooked, if not one of the number one things overlooked in nursing right now. Sepsis is not just an infection, it's not just a fever. Sepsis actually means the infection is now affecting how the body works. From blood flow, oxygen delivery, and organ function, it all starts taking hits. Now this is what nurses need to lock in with. If your patient has an infection and you're starting to see the heart rate trend up, the blood pressure is trending down or needing support, urine output is decreasing, there's new confusion or restlessness, the labs are drifting, especially the lactic. Okay, so let's go over SEERS versus sepsis because these two get mixed up all the time. SEERS, which stands for systemic inflammatory response, it just means that the body is reacting to stress, not necessarily infection. But it can be triggered by trauma, surgery, burns, pancreatitis, infection. With SEERS, you'll often see increased heart rate, increased respiratory rate, fever or low temperature, an abnormal white blood cell count. Now, SEERS is telling you that the body is under strain. It just doesn't exactly tell you why. Now, we're going to go into sepsis. So sepsis is sears caused by infection plus organ stress or dysfunction. That's the key difference. So sepsis means that there's a confirmed infection source, and now the infection is affecting how your organs function. So if your patient has an infection, you're seeing a decreased urine output, new confusion, rising lactate, worsening blood pressure, or need for support. And that's just not sears anymore, it's sepsis. Now, sears is a warning. Sepsis is the escalation or the complication. Knowing the difference helps nurses recognize when a patient is crossing the line and when to act early. So it's not really semantics, this is more of patient safety.